Hello, hello, hello. Assalamu alaikum. Jianu, Pakhair Ragale, Ni Hao, Tune Shume, Washmale, Ohio, Gonzaimes, Guten Morgen, Hola, Bonjour, Privyet, Kaifahal, Haleshama Chatore, Alan Vasalan Maraba, and a very amazing good morning to everybody who's out there tuning to PT1 and watching World this morning, alongside the very fabulous, the very amazing Shiza Hashmi and Shazad Khan. Hello, Shiza, how are you today?
I am good. That is a lot of greetings that you sent our way. Assalamu alaikum and good morning to all of the viewers who are watching our show. Welcome. Welcome back. You're watching World this morning, and today we are discussing a very important factor of well-being. You know, there's a very famous phrase in the world, health is wealth, and it's true. I mean, bad health, with a bad health, you are not able to pull anything off. You're not able to live a very good standard of life.
Exactly, you just don't feel great as well, because I've got a frozen shoulder for the last 1.5 years, and I just don't feel good about it, because every morning when I wake up, it's hurting.
But it must be restricting you from so many things that you want to do.
Yeah, it does. And, you know, there are a few things which I can't even tell. So it becomes interesting every other day. But today, ladies and gentlemen, we are going to focus on the functionality of our kidneys as well, because quite a lot of times over here within Pakistan, we do not have a trend of going to the doctors, getting ourselves checked up. Not even yearly, you know, not even biannually as well. So there's just no concept.
Exactly.
And you were telling us that, you know, just because of the kidney diseases, how many total number of deaths are there in a year?
About 20,000 people die because of kidney diseases in Pakistan alone.
Exactly.
That constitutes about 1.35% of the total deaths happening in the country.
So
annually.
The rates are alarming, and when we talk about kidneys, so kidneys are obviously there to actually, you know, clean the blood, take excess water out, you know, give you energy, food and everything, and then, you know, the urine goes to the bladder through the kidneys as well. So we really need to have to look after our each and every organ within the body, and just because we cannot look at them, you know, it gets difficult for us to actually realize what's happening. So there are different symptoms, there are different causes of different diseases which we have over here. We're going to, you know, talk about some 5 or 6 diseases related to the renal problems as well. So, and for that particular reason, we have been joined by somebody who's first of all a nephrologist. He's a kidney transplant specialist. He's MD FASN, and he's none other than Mr. Muhammad Rashid Ishaque. Hello, assalamu alaikum, sir. How are you? Good morning.
Walaikum salam. I'm fine. How are you all doing?
Absolutely perfect.
Good.
Thank you very much for joining us. So first things first, what is the difference in between a urologist and a nephrologist?
We know both of them are actually kidney doctors.
Yes.
But what is the difference?
Yeah, so historically, all over the world, people think urologists are the kidney doctors. But basically, difference between nephrologists is that nephrologist is a medical kidney physician who treats all the kidney disease medically.
Okay.
And the urologist is a surgeon, basically, who deals with the surgery of the kidneys, bladder.
Okay.
And in common terms, we call them like a plumbing doctors, because they do surgical procedures for the kidneys.
So then what is the difference? Because we write nephrology, you know, right next to your name, we have got nephrologist and then a kidney transplant specialist. So you're a nephrologist and a urologist both?
No. So basically, kidney transplant performed by a surgeon, and then we manage the subsequent post-op care.
All right.
So we manage the
Makes
medicine
sense,
part
right?
of that.
Okay, so let's get the conversation started, and we've shortlisted 5 or 6 diseases. We are going to talk about each disease. First of all, we're going to talk about the causes, the symptoms, the diagnosis, and then the treatment. So the first one Shiza has picked up on is?
It's acute renal failure, and it's usually, I think, observed in adults. But before moving on to that, I feel like the major reason of deaths happening due to renal failures is because they're not diagnosed. What do you think about that? How important is diagnosis in time? And also tell us about the prevention of these diseases, of the acute renal failure.
Sure. To start off, the kidney function is to filter your blood of the whole body, and then clean it and purify it and return the important nutrients back to the body.
Yeah.
So coming back to your question about acute renal failure, so there are 2 types of kidney disease. One is acute renal failure, which is happen acutely while patient in the hospital or suddenly. And the chronic kidney disease is a chronic disease, means it's a spectrum of disease which affects by the kidney. So acute renal failure happens while people are having acute dehydration, if they are out in the field in the sweating and they have vomiting, diarrhea. Any volume loss can cause acute renal failure.
Okay.
And secondly, some medicines, they can also cause acute renal failure.
Okay.
Like such common medicines like metformin we use for diabetes, and IV contrast we use during the heart angiogram, that also can cause acute renal failure.
So is there any way to identify these medicines?
Yes, so these medicines are identified, so it's has a blood test which can give us the kidney functionality, and we can diagnose acute renal failure by the blood test. And then there's a treatment for that is by giving IV hydration and preventing the medicines which are causing the acute renal failure. And so basically we have to keep an eye on it to make sure it doesn't happen.
And what happens in acute renal failure? I mean, they stop working or they partially working? What happens?
They partially kidney slows down and they stop filtering your blood, and then body retains all the toxins like urea and all the other electrolytes which kidney is supposed to filter. So that all toxic metabolites, they cause the damage to the body, and they can damage the other organs like heart.
And then what are the symptoms of this particular disease?
So basically, unfortunately, there are now not set aside symptoms. You have to diagnose those with a blood test. So symptoms mostly happen with like nausea, vomiting, dehydration, people feeling tired, and then they have to have a blood test. Without blood test, you can't diagnose acute renal failure.
Okay. So now moving on, moving on to the next one. Do you think that over here within Pakistan we see that there's quite a lot of anxiety, there's quite a lot of hypertension? Can all of these situations make you fall sick or make your kidneys perform not to the optimum level or just decrease the performance?
Yes. So now we're going to transition to chronic kidney disease from acute renal failure. So most common cause of chronic kidney disease in the world is diabetes. And the second most common cause is hypertension. So these both diseases can affect the kidney in the long term. And how they affect that: uncontrolled diabetes cause high sugar levels in the blood, and when that blood goes to the kidney, that damage, the high glucose damage the kidney. And how high blood pressure damage the kidney is that high blood pressure itself in the kidney damage the small blood vessels in the kidney, and then that causes scarring on the kidney. And all those processes decrease the kidney function, and then kidney slow down its function. Like normal kidney function is about 100%, and when kidney go below 50%, it slow down its functions. So it doesn't filter the blood properly. All the toxins which supposed to be filtered by the kidney stay in the body, and that damage the...
So do you get any symptoms on the outer side as well?
Very good question. So in chronic kidney disease, until it is in the late stages, it has no symptoms, unfortunately. But when the kidney further slow down from stage 3 to 4, and then people start developing loss of appetite, nausea, tiredness, so some vague symptoms. And then the blood test again, the blood and the urine test again will identify the problem.
So once it is identified, what are some preventive measures that one should take?
Yes, so it's a very good question. So the chronic kidney disease basically is a spectrum of disease which involves a basic preventive care. So patients have to control their diabetes and high blood pressure, because they in return damage the kidney. So first we control the hypertension and diabetes, and then we control their diet. Diet is very important part of the kidney disease treatment, and it's come in the prevention.
I mean, there's so much that we don't know. We just feel like a bad diet causes diabetes, but it also causes renal failure. We never knew that, right?
I mean, I think that, people might still not even know that, and they're not even around now.
Exactly,
so,
true.
So this is the problem. This is why we're here. This is what our job is, to raise awareness as well. Now, there are 3 most common things within Pakistan. I'm going to forget this for a while. First of all, people over here in Pakistan get quite a lot of kidney stones as well. So what is the treatment for that? And then second, we do not have access to clean drinking water at all times. So what does the water we drink is doing to our kidneys, which is not fit for drinking?
So water is a very important part of kidneys and for our whole body. So if water is full of arsenic, mercury, or any other toxins which can damage the body, so when that water dissolves in the blood, goes to the kidney, that damage the kidney itself and the other part of the body. And to maintain adequate hydration is very important, especially in the summertime when people work outside and they lose certain amount of sweat and the loss of extracellular volume. So they have to drink adequate amount of water, because the chronic dehydration will also cause the kidney disease. If body is deprived of water, the kidney itself will gonna be affected.
Exactly. And then what about kidney stones?
Yeah, so kidney stone is a very common disease. It is basically a genetic disease, so it's run in the families. So the prevention of kidney stones is also drinking adequate amount of water.
Okay.
Means you should drink at least 3 to 4 liters a day to produce at least 2 liters of urine.
All right.
That will gonna flush the blood, flush the kidney, and stone will not gonna form.
Kidney stones usually form in children a lot. So I actually wanted to ask, is it because of the consumption of food? Is some specific thing that we're consuming in terms of food or drinking
Yes,
that causes these things? And how can we prevent them? How can we identify the things that we should not eat to prevent kidney stones from happening?
So there's a misconception that high calcium foods can cause kidney stone. That is wrong. So most common type of stones are calcium stones, but they need sodium to join calcium and sodium to form the stones.
Okay.
So in children, actually, our diets, especially the processed foods, have a lot of salt in the food.
Okay.
And the high salt is a precursor to form stones. And especially when kids drink less water and high salt diet, that really lead to the stone formation.
Okay.
So there's a keystone for the treatment to drink a lot of water and low salt diet.
Okay, that's good. And then there's one more thing, and it might be a myth as well, but I want to bust this myth. That is that you mentioned about kids drinking water as well. Then at times kids drink quite a lot of water as well, different juices, drinks and whatnot. And then at the same time they do not want to go to the washroom or to use the washroom because they're so busy playing. Does it have an impact on your kidneys when you hold it in your bladder for long?
Definitely. So all these juices and drinks and the sodas have a lot of salt and phosphorus.
Okay.
They also damage the kidney and help in stone formation.
Okay.
And holding the urine is a very bad sign, because if you hold the urine gonna backs up into your kidney and will damage the kidney.
Oh, okay.
Because kidney is not designed to hold the urine, it's just to filter the blood.
Filter, right.
Bladder is designed to hold the urine for a short period of time.
Okay, so you happen to be a kidney transplant specialist in the US.
Yes.
I wanted to ask about Pakistan, because this is not a very well received concept in Pakistan. People are very conservative about organ transplants in general. So do you face any problems in convincing people to actually look into it because it's a better option?
Actually, before answer that question, I want to answer that treatment of kidney failure when kidney fails is dialysis, which is a very financially burdened procedure and has a lot of complications. So patients undergo dialysis 3 times a week. It's very costly, and especially in Pakistan, there are not many dialysis centers.
Right, true.
So the ultimate treatment of kidney failure or kidney disease is kidney transplant.
All right.
In that way, they don't have to do dialysis. They just take certain medicines to have the kidney transplant survive, and then they move on.
And what is the success rate of kidney transplants?
It's pretty good, actually. The 10-year success rate is more than 80%.
Oh, wow.
Yeah, so there are 2 different types of kidney transplant in US. One is the diseased kidney transplant. When people die, young people die in an accident, they harvest the kidney and then match with the donor, with the recipient, sorry. And the second is the living related kidney transplant, which is happening in Pakistan, which is the most common transplant. Like if your family member wants to donate the kidneys, so they will be tested for compatibility and they get transplant.
Okay.
All right. And since we're running out short of time and we have to wrap up as well, so very quickly, what can be the best home remedies to keep your kidneys fit?
So best,
other than drinking water.
Yeah, best remedy is your diet.
Okay.
So salt is the most common risk factor for any disease, for hypertension, for chronic kidney disease, and especially the your low protein diet.
Okay.
Because high protein diet will convert into urea, which has to be filtered by the kidney. So if you eat less protein, less salt, and that will gonna help the kidneys to work less.
All right, amazing that is. Thank you very much for being with us. It was lovely to be in conversation with you. And for all those people who are out there, so, we try to share information about whatever we think is important for you. So please make sure that you guys look out for your own selves as well. And Shida, do you want to say anything? Do you want to add anything?
Yes, I just feel like this segment was so enlightening for me. I mean, drink a lot of water, avoid, consuming salt. And we always knew that we have to consume a lot of protein foods.
Yeah.
But as doctors just said, that a lot of protein is not good for the kidneys. So I think it's time to wrap up the show. I hope you all had a good time like we did.
Yes.
And it was so informative.
It was indeed, and we hope that everybody's taken away anything, or at least something from the show. Or if you haven't, or if you have missed out on anything, please write to us on our Facebook fan page, which is with the name of
World This Morning.
On Twitter.
World This Morning, mine is G.
And Daily Motion YouTube.
World This Morning.
And the fabulous repeat is going to be at
11 p.m. at night.
Exactly. So look after yourselves. 1, 2, 3. Good morning.